My name is Grant Gallinger, and I'm going to be talking about the importance of knowing the different treatments in hyperhidrosis. So I chose this topic first because I suffer from hyperhidrosis, and what hyperhidrosis is this excessive sweating in a certain area of the body. There are actually two types of hyperhidrosis, primary and secondary. Primary hyperhidrosis is when it's from birthhood till you die. Secondary is from medication, the side effect from medication. So I'm going to be focusing primarily on primary hyperhidrosis. So actually 5% of the world population suffer from hyperhidrosis. So it's not as high as cancer or obesity, but it is an issue that needs to be addressed, and those that suffer need to know the different treatment options that are possible for them. So first, the primary one that's been used for years and years is surgery. It's called ETS surgery. And sadly, ETS surgery leads to compensatory sweating, which is redirecting of the sweat to another area of the body. And in a study that was done with 121 patients, 87% of them developed compensatory sweating. And because of that, it actually really is not the best option. And a lot of people don't know that. So that's why I'm going to talk about two other options right now that are actually better for the patient and have little to no side effects. The first one is botulism treatment, and that is where you get injections in the area. You usually only receive that injection once a year, and then from that, it really decreases. So in a study done from 50 patients, 88% gave an A or a B on their satisfaction rating, and because of that, there was, like I said before, little to no side effect. Maybe a little bit of reddening of the skin, but no compensatory sweating or anything like that. And the more it's done, the more your body accepts the treatment, so their sweating actually goes down and down, so you don't need the treatment as often. The next one is called microneedling, and this one is also, once again, a non-invasive procedure. Not a lot of research has been done on microneedling, but in studies that I've seen, once again, it has little to no side effects, and people's satisfaction rates are usually 70% of patients are satisfied with this procedure. So my main thing is people just need to know that hyperhidrosis is an issue, and that surgery is not the only option for them, that there are other options that they can look at to be able to help cure this disease so they don't suffer. Because sadly, a lot of youth, I experience this, growing up have shame, or they get teased, and this can cause psychological damages. So the more we can reach out to those affected, the more we can give them the proper treatment options, the better they'll be.